The other test I'd be curious too for somebody that feels like they're healthy and they're doing all the right things is getting a CT or MRI and seeing what's going on with visceral fat. And I feel like this is becoming more and more of a conversation. I know you write about it in your latest book. Visceral fat, people can appear to be normal weight on the outside and have all kinds of trouble happening on the inside. So let's get into what that is and what causes that.
Yeah, visceral adiposity is a huge marker of metabolic disease. And so there are several ways that you can kind of detect it without spending the money for a full body MRI, which that's the gold standard, but that's super expensive. No insurance is going to pay for that, and many patients can't afford that. I recently had a discussion with Dr. Sean O'Mara, and he's a big proponent of that. And for patients who can afford it, absolutely get a whole body MRI. That's going to show deliberately how much fatty viscera you have. And so, in the same way that we fatten up cows so that the ribeye is marbled and beautiful and tastes delicious by feeding them grains and corn and other grass seeds, that works for humans as well. And so humans can suffer from fatty liver. They can also have fatty pancreas. And most doctors have never heard of that, and no patient has heard of that unless they watch my YouTube channel. You can have fatty heart, you can have fatty lung, you can have fatty tongue. Vast majority of people with sleep apnea have fatty tongue. If you do an MRI of their oral pharynx, you can see the marbling in their tongue muscle just like a ribeye. And you can also have fatty muscle in your legs or in your arms. And so when you're eating too many carbohydrates, your body's trying to put that somewhere. It turns it to fat and stores it. When you get fatty liver, that's the first step towards type 2 diabetes. When you get fatty pancreas, you're either severe pre-diabetic or type 2 diabetic. And so checking visceral fat is a huge thing. And most doctors have no idea how to do it. Now, the way the average person can get it checked relatively inexpensively is to get a DEXA scan, which is historically used to check bone density. And so a lot of women will have heard of a DEXA scan because that's how they get their bone density checked. But you can also flip a couple of little buttons on the DEXA scan and it'll check visceral fat. And so for about $100, you can get that done. And if your doctor refuses to order it, you can go to the average diagnostic imaging center and you don't even need a doctor's order. You can get it checked and they'll charge you 70, 80, 100, 150 bucks. And then now you know, am I truly metabolically healthy? And this where it really, I think, does the most good is for people who are skinny, right? They're like, no, I eat pure junk all the time. And I look at me, I'm the picture of health until you check that DEXA scan or that CAT scan or that MRI. And then you see all this visceral fat and you see usually sarcopenia. They don't have nearly as much truncal muscle as they should have, and they've got way too much intra organ fat in the liver and in the pancreas and other organs, but also fat surrounding those organs inside the visceral fat. And that they're in some cases they're actually at higher risk of heart attack and stroke than somebody who's just fat on the outside.
You mentioned Dr. Sean. I recently chatted with him as well. And the way I understand it from him is that when you get this fat around your organs, that's going to make your inflammation in the body go up, which ties back to the heart disease that you were talking about earlier.
And
So
the
we're putting the whole picture
vasovasorum
together.
and the glycocalyx. That's exactly right. It all ties together. Yes.
So you mentioned their DEXA scan. Is there any value in just taking a measurement around the waist?
Yeah. For people who just have no financial resources at all, you can buy a $2 Taylor's tape and you can do what's called a waist to height ratio. And so you measure your height in inches or centimeters, and then you measure your waist at the biggest part, usually right around the belly button, but the place where you don't want to measure your waist. That's where you measure it in inches or centimeters, and you keep the units the same, and then you divide the waist by the height. And if that number is greater than 0.55, you've got some degree of visceral adiposity. And the higher that number is, the worse your visceral adiposity is, and the more danger that you're in. So, waist to height ratio, that's a great way to just measure this at home. If you don't have the financial resources to get a DEXA scan or an MRI, you can do that. And if it's above 0.55, you need to work on lowering that. And the way you lower that again, is to eat a very, very low carbohydrate diet. That's step one. And then step two is start to do some kind of high intensity exercise, either weight bearing or sprinting or swimming or cycling super fast to start to burn off that visceral fat. And once you've reversed that and you've got it clean coronary arteries, it's almost like a 10-year guarantee that you're not going to have a heart attack for the next 10 years.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
Any disease you can think of that's chronic and progressive, it's being caused by hyperglycemia, hyperinsulinemia, and chronic inappropriate levels of inflammation. Your default setting is good health. And if you're not enjoying good health,